Welcome to The Exam Room, the podcast where we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. I'm your host, Rhiannon Windsor, and we're charting the course through patient engagement. Let's scrub in and get started. We're continuing our conversation with Sonia about engaging Medicare beneficiaries. So let's talk a little bit about the outreach strategies that work for you, Sonia. Could you start by sharing an example of an outreach approach that worked particularly well for a patient?
I think my outreach approach for all patients works particularly well, and that is just having a conversation. I don't go into the conversations with an immediate goal. It is always directed by the patient, but it's more of a conversation rather than checking off a box. I want to get to know the patient, learn what the patient's needs are, and then we'll structure our future conversations around those needs. But initially, it's just about having a conversation like I would with my aunt or uncle or my grandparent, finding out what needs they have, what concerns them, and going from there.
So no scripts.
Never a script. A script doesn't work. A script makes us sound like we're robotic. A script for me would be entirely different than a script for somebody else. All of our outreach, regardless of who's doing it, there's never a script. It's about having a conversation and how you're comfortable having that conversation.
So what type of language or communication style would you say works best?
For me, I don't use a lot of health lingo. I use layman's terms, things that these people are going to understand. I don't go into depth with definitions, and I make certain that when we're talking with each other, we clearly understand what we're saying to each other. It's not something that they might have to look up later to understand. We want to make certain that the beneficiaries know what we're talking about and simplify it for them so that there's no confusion later.
Yeah, I think a lot of times as healthcare professionals, we just get used to this medical language that we talk with each other and all of these acronyms that come along with it. And we might forget that our patients don't use those words.
Never.
Sometimes, but it's best to proceed with the
keep it simple.
With the keep it simple. And so what would you say about your tone? Because there's, they can't see you. There's no body language.
The tone is always inviting. The tone is a helpful tone. The tone's always going to be like a friend talking to a friend tone. Never judgmental, never authoritative, always friendly, outgoing, helpful, listening, just to make them feel comfortable. Absolutely as natural as possible. I don't know these people, but when I call them up, I feel like I know these people. I feel like this person could be my neighbor.
So are there times when, I'm sure there are, that you need to adapt your approach depending on who you're talking to, and what kind of guides you in that shift in your approach?
I think it depends on the beneficiary, on how I approach it. I will say sometimes talking to men versus women is a different conversation and how you approach it. Overall, they're pretty receptive to a friendly tone and talking to them like you're a neighbor, rather than talking to them like you're a medical professional trying to dig deep into their medical background or history or what have you. If you're not probative but concerned, they're more apt to speak to you about it.
Mm-hmm. So can you think of an example that you could give our listeners of how you guided a conversation with a beneficiary?
So this happens frequently where beneficiaries question immediately out of the chute how we got their number and why we're calling. And I think on multiple occasions, it's about reassuring them that we're here to help. We're a free benefit to them because we work directly with their health centers, making them feel comfortable that our services will benefit them in one way or another. Doesn't necessarily have to be specifically on the medical side, meaning it doesn't have to be directly with their primary care physician or their specialist. Maybe it has something to do with obtaining a wheelchair or a walker, or securing their home so that it's safer for them to use the shower or to get up the stairs, etc. And when you start talking about simple things like making it wheelchair accessible, they start to perk up and talk to you a little more freely than just talking to them about their diabetes or what have you. Everybody's got something they can use help with. When they start thinking outside the box and thinking about things that they could have help with, it really kind of makes them open up. It may just be educating them on some of the resources that are available to them already. Or maybe it's getting them signed up for resources that they can take advantage of. But they don't know. And, how are they going to use what they don't know? So it's our goal to make sure they have all their resources at their fingertips.
Yeah. So you're using that discovery, that active listening, helping them to kind of identify their unique needs and then adapting your approach based on what they need specifically.
Absolutely. Everybody's different.
I think just keeping that mindset that the person isn't necessarily what's on the paper. You're doing your research, and there's so much more to a person than just their medical record.
Right.
So are there any non-traditional methods that you've used and were surprised by their success?
I think the most non-traditional method that is always successful is having these conversations with these people, not putting a timeline on it, not using a script, and letting the conversation be led by the beneficiary. I can tell you that I have had 2-hour conversations with beneficiaries about their everyday lives. I've talked about how the neighbors raise pigs and they like to go over and sneak food to the piglets, how a farmer broke his hip, and my concern was how was the hay going to be bundled that season. So it can go many different directions, but these are the things that are important to the beneficiary and so therefore should be important to me. One of our beneficiaries was very much concerned about the squirrel family living in her backyard. That's her daily importance, and that should be important to me. And if she can't get into the backyard to feed those squirrels, she's very concerned. And so if her back porch needs to be fixed so that she can get into the backyard, then that's a priority to me, because she loves that family of squirrels. As weird as that sounds.
Adding that value to value-based care.
And for somebody to listen to them about a family of squirrels in their backyard amazes them, because apparently nobody listens to them.
Well, and when you start to cultivate that feeling with the beneficiary of like, oh, somebody cares and somebody's listening, like that lifts their spirit, that does things in their brain that actually contributes to overall health.
Mm-hmm. And it builds our relationship with them, which is important.
So would you say that you have some go-to strategies when you're trying to re-engage a patient? And if so, what might those be?
The go-to strategies, I think, are finding out about the patient and not just about their health. I can read a piece of paper or their medical chart. Finding out about the patient and their daily lives and what's important to them, and then building on that. If it's difficult to get people to engage with the health professionals on a medical basis, then we have to approach it differently. We have to look at the beneficiary as a whole person and know that what's important in their lives is what's going to get us there. So if they have other things that are needed that aren't necessarily medically related, that are important to them, we start there and build that trust, build that rapport, help them find solutions so that they will let us help them with their medical journey as well.
Mm-hmm. And I would venture to guess that there's quite a few of them that are either disgruntled with the healthcare system or they've had poor experiences. How do you repair that damage?
Sometimes it's not repairable, but sometimes it is. It just depends. You find it might take 2 or 3 phone calls to really get them to open up, but that just means I'm learning more and more about them each time. And they're learning more and more about me. And they're trusting me more. And then maybe we start branching out to other people on staff who might be able to assist them with different things that they need. And they start trusting the organization as a whole. We want to make sure that we hear what their concerns are in regards to their treatment in a healthcare facility. We recognize it, and we let them know that our concerns are their concerns. We don't tolerate bad treatment, obviously. If we can't repair it with that particular facility, we offer up providers at other facilities. And if that doesn't work, we also offer our services to help them find a primary care physician outside of our facilities. We just want to ensure that they have somebody managing their care. So it doesn't mean that it has to be with one of our health centers, but it's important that they do have one. We can recommend providers that we have gotten testimony from other beneficiaries that those providers have really come through for them. That's also helpful if they hear that we have other beneficiaries that recommend specific providers, whether they're in our clinics or not.
It's so much more than just making a phone call.
A lot more than making a phone call. The fact that they finally feel like they're being heard and they're being actually helped, that is the most rewarding part. Because so many times people have dropped the ball, promised and not delivered, and they feel like they are out of options. I know that when I call my own mother, who lives in the middle of nowhere in Alabama, we talk about some of the people in her community and the lack of resources that they have there and the lack of support that they get from their own family members. And I've always felt passionate about how no one should be left without help, and everyone should be able to live as healthy as possible.
Thank you for joining us in The Exam Room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation on patient engagement was as insightful as your last checkup. A big thank you to our guest speaker, Sonia Sanato, for sharing her expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. I'm your host, Rhiannon Windsor. Until next time, take care, and thanks for listening to The Exam Room.